Hi, I'm Dr. Neneman with Neneman Chiropractic Clinic, and thanks for joining us again for another week in our video blog series. What I'm going to talk about this week, this is a common statement that I get from patients all the time. I'll have a patient come in and I'll ask how they're doing, and they'll tell me, my lower back's hurting, but it's not my spine, it's just a muscle. I don't think it's a spine problem, I think it's just a muscle problem. I hear this all the time. And I also think this is a reason why some people might not come to the chiropractor when they have spinal pain, or back or neck pain, because they think, well, this is just a muscular problem, it's not a spine problem, so I don't need to deal with a chiropractor, it's just a muscle. So that's what I want to address today. That's a misconception. It's not a correct thought. Why certainly you could pull a muscle in your back. That happens all the time. But even if you pull a muscle in your back, it is going to affect the spine. You can't have one without the other. That's what I always say. The saying, what comes first, the chicken or the egg? What comes first, the spinal misalignment or the muscle tightness or strain? They're both involved usually. So if a patient comes in and they think that it's a muscle problem, if there was no trauma to where they could have actually tore the muscle or anything like that, if their back just started aching, usually that muscle, and it may truly be a muscle pain, the pain may be coming from the muscle, but why is that muscle hurting? And usually it could be something like, they have pelvic misalignment, pelvic unleveling. Their pelvis could be unlevel. That's putting abnormal pressure on the muscles. The muscles are having to compensate for that. So that could be causing, so it comes back to the misalignment. The muscles are hurting because they're compensating for an unlevel pelvis. Or it could be they have a scoliosis. If the spine is abnormally curved, that changes the musculature. I mean, those muscles that attach to the spine, they're going to be put under a lot of pressure. There's going to be muscle hypertonicity because, again, those muscles are fighting. Those muscles always fight to try and support the spine to keep it straight. But when that spine's not straight, you will get muscle pain. So, and let's look at it from the other perspective. Let's say the patient truly lifted something heavy and they actually tore their lumbar paraspinal muscle. When that muscle tears, there's going to be a lot of inflammation, and with all that inflammation, that's going to create a lot of tightness in the area. And where does that muscle go? It attaches to the spine, and so when that muscle tightens up, it's going to cause that spine to either misalign, or it's going to cause that facet joint to lock up and be restricted to where it needs adjusted. So again, going back to what I said, you really can't have one without the other. If you have a spinal alignment issue, it will cause muscle tightness and pain. So when that, if you're thinking, oh, my muscle hurts, it's not my spine, well, the muscle hurts probably because you do have a spinal issue. And then vice versa, if you do truly strain or tear a muscle in your spine, when that inflames and tightens up, it's going to affect the spine. It's going to cause misalignment because everything's so swollen and tight. Hopefully this helps you realize that you can't have one without the other. If you think you're having muscle pain, it's probably related to your spine, and you should get it checked by a chiropractor. So definitely give us a call and let's get that checked out. We can adjust your spine, improve your alignment, and we also do accessory treatments to help with that muscle tightness as well. So one last thing I'd like to say before we close it out, what I'd really like to start doing with these blogs, for all of you that watch this, whether you're receiving it via email or if you see it on Facebook or our website, if you have a question that you would like to ask me or have me talk about, either reply to the email or send a message via Facebook or via our website. If you see the blog on our website, send us a message and with your question, say, hey, I've always wondered this. Can Dr. Neneman, Dr. Neneman, can you answer this for me? And I will actually answer it on a video blog. And if I do get multiple requests at the same, for the same week, obviously I'll probably only talk about one that week. So if I don't get to yours that week, I will get to it either the following week or the week after. So, but that's something I'd really like to start doing. So if you think of something you want to ask me, respond to this video blog via email or Facebook or the website and ask the question, and I will try to talk about it on next week's blog. So thanks for tuning in again this week. Hope you have a great weekend, and we'll see you back here next week. Thanks.